This video will be covering caregiver burden. I will be discussing the following topics: caregiver burden, risk factors, protective factors, causes, symptoms, impacts, and a reflection activity. Caregivers tend to the needs and concerns of a person with short or long-term limitations, secondary to illness, injury, or disability. According to Martinez, Martin, and his colleagues, caregiver burden encompasses the physical, emotional, and financial toll of providing care and is a broad and multidimensional concept. Subjective caregiver burden encompasses the emotional aspects and personal feelings of caregivers. Objective caregiver burden encompasses the physical and behavioral changes. Edelman and his colleagues suggested the following risk factors for caregiver burden: female sex, living with the care recipient, increased hours and lack of choice with caregiving, social isolation and/or decreased social activity, previous diagnosis of depression or depressive symptoms, financial difficulties, and care transitions. According to Martinez, Martin, and his colleagues, protective factors include frequency of breaks, social support, positive relationship with the care recipient, acceptance, and personality traits such as self-esteem, optimism, ability to draw meaning from the caregiving experience, and mutuality, or the sharing of a feeling or relationship between caregiver and care recipient. According to Johns Hopkins Medicine, potential causes of caregiver burden include physical, emotional, and conflicting demands resulting from the care receiver's condition, loss of prior roles or unclear expectations in current role, increased workload, lack of privacy, mastery, and one's ability to act on their own values and interests, and sleep disruptions or sleep deprivation. According to Johns Hopkins Medicine, some additional potential causes of caregiver burden include decreased self-esteem, physical fatigue or personal health problems, failure to achieve one's goals or expectations, and feelings of hopelessness, helplessness, or negative emotions. Mayo Clinic staff identified the following symptoms of caregiver burden: feeling overwhelmed, tired, or constantly worried, sleeping too much or too little, or feeling tired frequently, weight fluctuations, feeling easily irritated or angry, losing interest or desire to participate in previous activities you enjoyed, experiencing frequent headaches or other physical problems, and abusing drugs or alcohol. I have identified some of the symptoms of caregiver burden. If you recognize these symptoms as ones you are currently struggling with, it is important you take care of yourself, which can include contacting your doctor or healthcare provider. The impacts of caregiver burden on oneself includes physical, emotional, social, and financial impacts, decreased quality of life and reduction in quality of care, decreased physical and psychological health, such as physical fatigue, depression, anger, guilt, and anxiety, and forgetting one's own medication, an inability to recover from illness, and lack of time for exercise. Continuing on, some additional impacts of caregiver burden include missed days or interruptions at work, reduced productivity and leaves of absence at work, feelings of loneliness, fearfulness, and isolation, as well as occupational imbalance. We want everyone to have occupational balance, which is when an individual engages in the right amount and variety of occupations and activities to promote their overall health and well-being. Now that we are reaching the end of the first video, I want you to take some time to reflect. Below are some questions to promote self-reflection on the information you have learned thus far. Pause this video if you would like to take a moment to reflect and answer these questions. Have you experienced any of the symptoms or impacts of caregiver burden I previously mentioned? Are you at higher risk for developing caregiver burden? How could you apply this information to your own situation? The following videos address specific factors of caregiver burden, as well as resources and strategies to help mitigate this burden and support you as the caregiver. These are my references. Thank you for watching.